Welcome to this Lorenzo instructional video on the version 1 of the doctor's admission assessment. Please ensure you've accessed the patient record via the ward pegboard before creating any new forms. Then, from the Clinical Charts tab, right-click on the Admissions tab, hover over Forms and select Doctor's Admission Assessment. Once the form is loaded, you can then record the admitting clinician, the professional code or job role, the source of admission, the admitting ward, any presenting complaint, history of presenting complaints. You can also record the permission to access the GP summary care record, followed by any past medical history. As we scroll down, we can then record any medication clerking. To record medication clerking, click on the form launcher icon to the right hand side. You'll be prompted to record any allergies or adverse drug reactions, followed by the medication clerking source. Click OK. To add in items, click on the Search tab and type in the first few letters of the required item. Then, from the search results, click on the name of the drug. You'll be presented with prescribing sentences, some receiving some dose, route and strength options. Click on the green arrow for the required option. Details can be amended by clicking on the form icons if required. For further assistance with medication clerking, please contact the training team on extension 46006. Click Finish to return to the form. Any allergies will automatically cite through into the patient's record. You can record then any recent changes to medication, including antibiotics, any medication taken today, followed by any social history and any comments. As we scroll down, we can then record the patient's smoking status. If the patient doesn't smoke, there will be less fields to fill in. The same goes for the alcohol status. Throughout the assessment, you'll be able to launch other forms if appropriate for your patient by clicking the form launcher icon to the right hand side. Some of these forms include the Alcohol Disorders Test, the VTE Risk Assessment, the Acute Kidney Infection Risk Assessment, and the Sepsis Pathway. These forms will be covered in a separate training video. The next section will allow us to record the examination. We can record if a chaperone was present and the general examination details. If abnormal, the details box will appear, allowing you to add comments. Continue through the form, recording as appropriate for your patient. Some sections of the form will allow you to record a customized outcome. Once you've completed some of the fields above, click the Customize Outcome tick box. Click OK to the pop-up. You can then enter any comments if required. Please note, if any of the above options are then changed, tick again the tiny tick box, re-tick, and it will refresh the box below. Continue down the form. Complete the respiratory section if appropriate. If not, continue down. If you wish to annotate on either of the diagrams, click on the blue Annotate text. You can then use the drawing tools on the left hand side to highlight any specific areas. Click OK, and this will pull through to the form. Once again, you can use the Customize Outcome to drag through any previous findings. Any active alerts will also drag through to the patient's record. You can then fill in any increased forgetfulness and dementia diagnosis information. If the patient has an advanced decision to refuse treatment in place, click Yes. It will then prompt you to record this as an alert if it does not pull through to the patient's record. Click on Show Hide, and then underneath you will be given the option to record the alert. There are also options to record the Glasgow Coma Scale and the neurology exam. Tick if appropriate, and below the appropriate options will appear. As mentioned previously, The VT risk assessment can be launched by using the form launcher icon. Continue to scroll down. Relevant results can be cited through from the patient's record, as we do with discharge summaries, and any result notes can then be added. Tick the box to confirm that you've requested the EGFR. That's the last mandatory section and will complete the rest of the ward note. If you need to complete the acute kidney infection form or the sepsis pathway, tick the boxes, and then again use the form launcher icons to launch those particular forms. Scroll down, and using the last two boxes, enter the differential diagnosis and treatment plan for the patient. The last section of the field can be used to record the senior review if an FY1 has completed the initial assessment. Click Finish. You will be then prompted to finalise the form. If complete, press Yes. The form will then display in the Admission tab. To view the options, drop down the section on the right hand side and scroll down as appropriate. If you need to amend the form, scroll back up to the top, hover over the square and use Correct Form. For any further information, please contact the service desk on 46000, or for any training support, contact Training Admin on 46006.